All right, welcome back. We're continuing our deep dive into adult ADHD. In this part, we're going to get into the nitty-gritty of the neurobiology, unpack the most effective treatments, and look at special considerations for different populations. And it's all based on a major review in World Psychiatry, so you know we're sticking to the latest evidence.
So, what does the evidence actually tell us about managing adult ADHD? Well, we're going to start with the science of the brain, and then we'll see how that knowledge connects directly to what works in the real world, clinical practice and proven treatment strategies. Okay, let's get right into it, starting with the brain itself. We're going to explore both the cognitive challenges, the things people experience day to day, and the biological mechanisms that are actually going on underneath the surface. When the frontal lobes of the brain are affected, it can cause something called dysexecutive syndrome. And what's so fascinating is that the key features of this syndrome, things like trouble with inhibition, with working memory, with planning, well, they are the very same hallmarks of ADHD. It's a really striking overlap. So what's the bottom line here? It's that neuropsych tests can be a really helpful tool, for sure. They can help build the clinical picture. But, and this is a big but, they absolutely cannot be used to diagnose ADHD on their own. There's just way too much individual variability. In fact, a lot of adults with confirmed ADHD don't even show major issues on these specific tests. And this leads us to a really fundamental point in the field today. You know those subtle brain changes we sometimes see in kids with ADHD? Well, in adults, they're often much less obvious or maybe not even there at all. And that means, right now, we have no reliable biomarkers, no brain scan, no blood test, nothing that can give us a clinical diagnosis. Now let's switch gears and talk about treatment. We're going to take a close look at how ADHD medications actually work, biologically speaking, and what the big picture evidence says about just how effective they are. So this is where the action happens, right at the synapse. The goal of all these medications is to increase the amount of available dopamine and noradrenaline in the brain. These are the key neurotransmitters for things like attention and executive function. And you can see the main players here: the stimulants, like amphetamines and methylphenidate, and the non-stimulants, like atomic cofaxine. Okay, so the big question, do they actually work? Well, according to a massive meta-analysis that looked at over 100 different trials, the answer is a pretty resounding yes. Stimulants have what we call a moderate to large effect size, while non-stimulants show a solid moderate effect. The key takeaway is that these meds are really effective for the core symptoms of ADHD, even if they don't fix every single issue with executive dysfunction right away. But, getting a prescription is really just the first step. The real art and science comes next, in optimizing that treatment for each person and monitoring it really carefully over time to make sure it's safe and effective. Now, this is such a crucial concept for everyone to understand. These dose-response curves show that when it comes to ADHD medication, more is not always better. See, with methylphenidate, you start to get diminishing returns at higher doses. And with amphetamines, you hit a clear plateau where cranking up the dose just doesn't bring any more benefit. This is exactly why careful, individualized dose optimization is so important. And of course, optimization goes hand in hand with safety. Vigilant monitoring is absolutely non-negotiable. The three big areas to watch are cardiovascular health, sleep, and any psychiatric symptoms. And it's especially critical for patients with bipolar disorder. They need to be stable on their mood stabilizers before even thinking about starting a stimulant, because of the risk of triggering mania. Now, this is where things get really interesting. When you look at short-term, highly controlled studies, they often have a hard time showing a clear benefit over placebo after about a year. But when you look at massive, long-term, real-world data from huge populations, the results are just striking. Medication is linked to significant reductions in really serious negative outcomes like car accidents, run-ins with the law, and even premature death. So this all leads to a much bigger picture of care, right? Because ADHD almost never shows up alone. Truly effective management means you have to address any co-occurring conditions and help people develop practical life skills right alongside their medication. Okay, so when you're managing these comorbidities, there's a clear order of operations. The number one rule, the absolute top priority, is that mood disorders like bipolar disorder must be stabilized first, before you introduce a stimulant. Once that mood is stable, then you can effectively address things like anxiety and depression.
So the crucial point isn't about pills versus skills. It's always been about pills and skills. Medication is amazing at targeting the core biological symptoms of ADHD. But therapy, like cognitive behavioral therapy, that's what gives patients the actual strategies they need to manage the real-world challenges of the condition. The best, most holistic care happens right there in the middle.
Now let's dig into how ADHD can present differently in different populations. It's so important to recognize that this condition doesn't look the same in everyone, and that means good management has to be nuanced and has to be individualized. This iceberg metaphor is just a perfect way to understand how ADHD often shows up in women. What you see on the surface, the anxiety, the depression, the low self-esteem, that's just the tip of the iceberg. Underneath the water is this massive driving force of underlying and often inattentive ADHD. And this can lead to something called diagnostic overshadowing, where only the mood symptoms get treated, while the person is left struggling with the unaddressed root cause. And when we look at older adults, the diagnostic picture gets even more complex, because ADHD symptoms can look a lot like things like mild cognitive impairment. The key differentiator here is the person's history. ADHD is a lifelong developmental condition. MCI, on the other hand, represents a decline from where they used to be. Treatment also requires extra caution, since older adults are more likely to have cardiovascular issues or be on other meds, which increases the risk of interactions. Wow, we have covered a ton of ground, from the deep brain science all the way to day-to-day clinical practice. So let's boil all of this down to the most important take-home messages from the evidence we've just walked through. All right, here are the 5 key takeaways. Number 1, adult ADHD is a real, valid diagnosis. 2, we don't have biomarkers, so assessment has to be clinical. 3, the medications are highly effective. 4, critically, you have to treat co-occurring mood disorders first. And 5, the gold standard of care is combining medication with skills-based therapy. And this brings us to our final and really critical challenge. Because despite all this amazing scientific progress, there are still these huge systemic failures. We have the transition cliff, where countless young adults just fall through the cracks as they age out of pediatric services. And compounding that is the staggering fact that research into adult ADHD gets less than 15% of the funding that pediatric ADHD does. It's leaving a whole generation of adults undersupported. Which leaves us with a really urgent question. How can we bridge these systemic gaps to make sure that every single adult with ADHD gets the opportunity not just to manage, but to actually thrive? It's a huge challenge, and it's one that researchers, clinicians, and policymakers really have to tackle together. Thank you so much for joining us for this explainer on the evidence base for adult ADHD. I hope you found it useful. And for anyone who wants to go even deeper, we highly recommend checking out the original source material.